So today we are going to speak about another topic called endometrial cancer or uterine cancer. So we've heard this topic many times, but what is uterine cancer? So the uterus is divided into two parts, the body of the uterus and the neck of the uterus. The neck of the uterus is called cervix, and that is a cervical cancer. We will speak about that later on. And today we are speaking about the lining of the uterus. The cancer that arises there is called the uterine cancer or endometrial cancer. So why am I speaking about it today? Because it has been seen that the incidence of endometrial cancer is gradually rising even in countries like India. Now, what is the reason for this increase? It is mostly because of our lifestyle. So, lifestyle these days has changed a lot. Everybody is working, no time for exercise, and also due to the COVID situation, many people were not able to exercise and lot of calories were put on. Now, endometrial cancer is directly related to obesity or increase in weight. Also related to another common symptom called polycystic ovarian disease. These patients have a higher increased risk of developing this kind of a cancer. Also, patients who have a genetic tendency to develop this disease, or some patients who have taken certain medications for breast cancer, or they are on any estrogen supplement, or patients who have diabetes, blood pressure, all these kind of diseases predisposes us to get endometrial cancer. Now, what are the symptoms and signs of endometrial cancer? How does one suspect that you may be having something dangerous like this? Now, certain symptoms come forward, and because of which most often this cancer can be diagnosed at an early stage if you do not ignore the telltale signs. So, any woman who is more than 40 years of age, as this cancer affects mainly women in their later years. So, anybody more than 40 years of age who has abnormal uterine bleeding means that you are bleeding too much or too frequently for a long time, or the other group of women who have already had their menopause, that means that your periods have already stopped for more than 1 year and then suddenly you develop bleeding. Whether it is spotting, whether it is a lot of blood, it has to be evaluated by the doctor, by the gynae-onco, and decide whether this bleeding, abnormal bleeding, is due to cancer or due to other causes. Well, most of the time it is not due to cancer. It can be other causes like some fibroids or endometriosis, but you need to rule out after menopause. Also, it is not always cancer, but we need to rule out that it is not cancer. So what do? Generally, your doctor will advise you to do an ultrasound examination, and we measure the thickness of this layer. If it is very thick, well, then you need a biopsy to rule out that there is no cancer sitting there. Now, what are the modes of treatment for this once it is diagnosed? So, if it is diagnosed very early and the stage is early, the cure rate is very good, and mainly it is treated by surgery. If it is very early in stage, then maybe after surgery sometimes you do not need any radiation or any chemotherapy. But if it is diagnosed later on, then you may need these additional treatments. Now, what form of surgery? Generally, these kind of cases, we see that the woman is quite obese and it is difficult to do an open surgery. Here comes the role of minimal invasive surgery. By minimal invasive surgery, we mean by laparoscopy or by robotic assisted surgery, wherein we make very small holes in the tummy, and this whole surgery can be done, and studies have shown that even in obese patients, this kind of minimal access surgery helps them to recover earlier with the same survival benefit, and there is no decrease in the survival rates. Following that, the patient can be then assessed again whether she needs additional any radiation. Now, what is the survival rate? Well, it depends on many factors. What is the type of the disease that you have, the histological grade of the disease, whether it is spread somewhere else, or that is the stage of the disease. So, the earlier you diagnose this, the better the rate of cure, and that is the reason that I have taught you today to recognize these symptoms and seek help at the earliest.